guest this morning is Dr. Daniel Kuritzkes, who is Chief of Infectious Disease for Brigham and Women's.
Good morning.
We're here to talk about immunizations. We're here to talk about back to school immunizations. And we want to talk about what we are expecting to be what they call a twindemic. And so let's first start with the history of vaccines, sir, as you understand it.
So vaccines are one of the two most important public health measures that have really improved the life of everybody on the planet, the first being improvements in sanitation and then vaccines to prevent infectious diseases. And vaccines have a really long history, beginning in the late 19th century when people first, or maybe even early 19th century when people began vaccinating against smallpox. But then vaccines really took off with Pasteur and the rabies vaccine, and then our ability to protect people against the tetanus and diphtheria, and then in the 1950s, our ability to protect against polio, and then later in the 60s, all of the childhood diseases like measles and German measles or rubella and mumps. And so this has been incredibly important to protecting the health of the public. And every year we have a flu vaccine, and it's important every year for people to get vaccinated against the flu.
The impact of the flu fluctuates from year to year, season to season. What do you anticipate the flu season to be like this coming season?
It's a little hard to predict what this year's flu season is going to be like for a couple of reasons. One, as you say, every year there are differences in the strains that circulate, how much they circulate, and how many people get infected. Maybe I'm too much of an optimist, but I think that here in Massachusetts, because we are so good at listening to the governor's executive order and wearing masks, we might actually see a relatively mild flu season if we all continue to do the things we're doing to protect ourselves from COVID-19. They will also protect us from the flu. Now, that's not to say that you shouldn't still get a vaccine, but I'm hopeful that we might see a lower rate of influenza this winter, at least in Massachusetts, because of the measures we're already taking to protect ourselves from COVID-19.
What is this term that I'm hearing an awful lot about, twindemic?
So we know that influenza is highly seasonal. It breaks out in the colder months. So here in our winter, between October and March, with a peak that usually occurs in January or February. In the southern hemisphere, of course, that happens during our summer and their winter. Usually they go first, and then the flu season follows here. And we're also concerned that the same factors that cause the flu to be more prevalent in colder months, the fact that people are indoors, less circulation of air, the more crowded spaces, that those same factors could lead to an increase in the spread of COVID-19, leading to the simultaneous occurrence of a flu epidemic and resurgence of the COVID-19 pandemic.
So would it be advisable for certain segments of our population to get our flu vaccines sooner than later?
I think everybody should be vaccinated against flu this year. And by everybody, I mean anyone who is 6 months and older. So that pretty much covers the whole population. And I think that people should get vaccinated as early as they can. Now, we know that people who have heart conditions, lung disease, older people, people with other medical problems are more susceptible to severe influenza, just as they are also more susceptible to COVID-19. And so those people particularly should be certain to get vaccinated. But I think everybody should be vaccinated as soon as they can be.
How do you know the difference between symptoms of flu versus symptoms of COVID?
It's really challenging to distinguish influenza from COVID-19 solely on the basis of clinical symptoms. I mean, there are a few differences. COVID-19 more commonly causes pneumonia or infection of the lung than influenza, which is more of an upper respiratory infection. And so people more often will have cough and chest pain and shortness of breath with COVID-19 than with influenza. But that's on the more severe end of this COVID spectrum. But the typical case of COVID-19 is just like the typical case of influenza. People have fever, muscle aches and pains, they'll feel run down. We know that people with COVID may have a runny nose and sore throat, just like people with influenza might. And so that's why it's so challenging to distinguish them just on clinical grounds. And in fact, last year, earlier this year, last season, as the flu season was tailing off and COVID was just picking up, what the health department was noticing was an increase in the number of cases of what they were defining as influenza-like illness at a time when influenza tests were going down as far as positive rates. And that was all of the COVID cases. And that just shows you how hard it is to distinguish them. You really need the tests to be able to tell you whether it's flu or whether it's COVID.
Is Brigham and Women's ready to handle the response, the demands that may materialize here in the course of this twindemic?
But we are certainly prepared. We, as a system, did, I think, an outstanding job, as did all of the hospitals in Massachusetts, in being able to mobilize our resources to meet the challenge of the surge in COVID cases that we saw during the spring. And we learned an awful lot through that experience. And our emergency preparedness task force is now hard at work laying the groundwork to ensure that we are able to respond if we do indeed see a second surge of COVID-19 and a superimposed flu epidemic during the late fall and winter months of the coming season.
Any final words to share, final pieces of advice, Dr. Kuritzkes?
I think the two most important things for people to take home are, first of all, you can protect yourself against COVID-19 and influenza by making sure you wear a mask, be socially distanced, and wash your hands whenever you can. And secondly, go and get a flu vaccine so at least one of the two viruses that's likely to circulate this fall and winter, you can be protected against by a vaccine.
Dr. Kuritzkes, thank you for visiting with us today. Thank you for taking the time. Continue to stay safe and healthy, and we look forward to continuing visiting you in the future, sir.
Well, same here. It's been a pleasure talking with you and always happy to help.